Hello. Good afternoon, everyone. Good afternoon, everyone. My name is Irene from Infection Control Department. Welcome on my live stream topic discussion for today. Our topic for today is about blood and body fluids spill kit management, exposure to bloodborne pathogens. Let's start. I will present to you the first part, uh, the blood and body fluids spill kit management. Hoping this time I will not be lost and not interrupted. Anyway, let's start. Show must go on. Okay, I will explain to you the management. And on the next part will be explanation for the exposure to bloodborne pathogens management. Okay, this is our blood and body fluid spill management. What is the purpose of this? This policy is intended to provide guidance to staff to safely and effectively manage spillage in the hospital. Sorry, because my chair is very noisy. I know you can hear it. And the school. This policy is for all staff working that may the course of their routine duties be exposed to blood or body fluids. And this for all patients areas must ensure that they have a spill kit available in the clinical area. I will show you, I have one here sample of the spill kit that I bring, and I will show it to you. All staff should receive training in spillage management, and appropriate equipment must be available. Our definition of terms. Spillage is contaminations of the environment by blood and body fluid or excreta. Spill kit is a pack that contains all the essential equipment for dealing with spillages, including your PPE, your personal protective equipment. and cleaning materials. When you say body fluids, this includes your respiratory and oral secretions, vomit, vaginal secretions, amniotic fluid, the feces, the urine, wound drainage, semen, cerebrospinal fluid, pleural fluid, gastric aspiration, breast milk, and earwax. Next, spillage flashes on skin or mucosa. On abraded or intact skin, this is what you do. Wash skin with soap and copious amount of water, and then next fill up the OVR. And what is the OVR? This is your variance report. Occurrence variance report. Then inform your supervisor. Then apply first aid. Wash skin with soap and copious amount of water. You will need to avoid scrubbing with brush and do not use disinfectant. Go to ER, then fill up the OVR, then inform the supervisor. Next step, follow up on treatment. The spillage flashes on skin or mucosa, nose or throat. Is apply first aid. Immediately spit out the blood or fluids and rinse the mouth with water several times. Blow the nose and clean the affected area with water and saline. And do not use disinfectant. Go to ER, uh, fill up OVR, inform supervisor, then follow up on treatment. Same method in the eyes. Apply first aid as the area gently but thoroughly with running water or saline for at least how many minutes? It must be 15 minutes. Okay. While the eyes are open, of course it's open, not closed. Then go to ER, fill up the OVR, same method. Inform your supervisor, and follow up on treatment. This PowerPoint I presented to you today is very short, but on the next topics that I will include, it takes more minutes. The exposure to bloodborne pathogens. Anyway, let's continue. Nose or mouth. Apply first aid. Immediately spit out the blood or fluids. Nose or mouth. And rinse the mouth with water several times. Blow the nose. How will you blow the nose? And clean the affected area with water or saline. And do not use disinfectant. Again, go to ER, fill up OBR, and inform the supervisor, and then follow up on treatment. Spillage on surfaces other than the skin. He was dancing. This is to protect personnel and patients from contact. Spillage on hard surfaces must be properly cleaned immediately. Dry the blood remains infectious for several days. Okay, the blood and body with the spill management. Let's start. You will close what? Number one is the cold sunshine. To be aware any stuff come or for it. They should know this. That's why you need caution. Caution sign is the most important one. And then next step is prepare your spill kit. Then you will wear PPE. I will add the video if because when I tried to when I tried to before this I had trial and he said still loading. So I will try if I show you the video today. Fill trigger sprayer with a 1:9 water, alkaline water, and then fill trigger sprayer too with 1:9 Clorox and water. Then put on paper towels on top of the spillage. Then wet spill area with trigger sprayer. Then wait for how many minutes? You need to wait when you put it. You will need for 2 minutes. Then wipe the spill from outer to inner stroke. Dispose like this from inner and outer like that. Then wet spill area with trigger sprayer. Then another wait for 2 minutes. Then wipe the spill from outer to inner and dispose. Then next is this is the time you will mop the area. This is concerned for who? For the cleaner. But even this is for the cleaner, the staff in charge must know this also, so that she knows what she will ask the cleaner for what he will do. Okay. On surface, blood and body fluid spillage, follow blood and body fluid spill management flow chart. There's the flow chart. And in the spill kit, there is, of course, the manufacturer instruction, so you will not be lost. It was it, at the back of the kit. The instructions is inside there. All the spill kit is like that. All. And then fill up OBR and then inform the supervisor, infection control, and safety officer. If urine, what you will do, the excess urine must be mopped up with paper towels first. So You should provide a paper towel first, not a lot to put the mouth there. Then followed by cleaning with detergent and hot water. See, they recommended the hot water. And the room should be well ventilated before this procedure is carried out. Now, these materials and equipments. The gloves, the plastic, the apron, the mask, the goggles, the eye shield, the head cover, the foot cover, the tongue, the sprayer, the leak for color coded infectious waste bag, and then your precaution sign. But which one is the first you should do? What I told, what I mentioned is you need precaution sign first before they start the procedure. Before open the PPE, this PPE, and before wear the PPE. Okay, yeah, that's it. Thank you. Okay, you finished that part, the first one. Just 1 minute. I thought I forgot to my microphone, but good now. Because every time I start, I forgot to on. And then I start talking, and then I see the chatbot, oh, your mic is not working. Now it's good. Just 1 minute. I will prepare the next because this is I don't have PowerPoint of this. This is I want you to be hear from my explanation. Not to hear my explanation, but yeah, just 1 minute. I will off my camera just 2 minutes. Yes, because hello, now it's working. My mic. Okay. The next is the management of sharps, injury, and exposure to bloodborne pathogens. Is the next is the one. Is our definition for this is to provide guidance for the management of HCW. It's not our healthcare workers who have occupational exposure to blood and body fluids. I mentioned about this. There is additional information for this. The sharp injury. Okay. This includes your occupational exposure, defined as percutaneous injury. What is that? The needle stick or cut with sharp object or contact of mucous membranes. Splash to eyes, nose, to oral cavity, or non-intact skin. Exposed to the skin and chapped, abraded, or afflicted with dermatitis that may place the healthcare workers at risk for what? For infection cause. For infection with hepatitis B virus, Hep C, or HIV, your human immunodeficiency virus. Okay. Any direct contact without barrier protections, so concentrated virus, in a research laboratory or production facility is considered an exposure that require the clinical evaluations. Potentially infectious materials includes the blood body fluids containing visible blood, huh, and tissues as well as the medical supplies, equipment or environmental surfaces contaminated with these substances. The following fluids are considered potentially infectious: cerebral spinal fluid, pleural fluid, pericardial and amniotic fluids, while the feces, saliva, sputum, your nasal secretions, sweats, tears, urine are not considered potentially infectious. Mhm. Not considered potentially infectious unless they contain blood. Okay, it's clear. I said feces, saliva, sputum, nasal secretions, sweat, your sweats, in Tagalog, pawis, tears, urine are not considered potentially infectious unless they contain blood. Sorry, because I have message here from the my PC. They need our email and contact number. They need 3 team from infection control. So I just check. Sorry for the interruption. Yes, I will submit after this lecture. Okay. For the continuation of management of sharp injury. Actually, I have a big projector beside me. It's better maybe I can stand up. Yes. Okay. And then any exposed healthcare workers should report immediately to your employer clinic during working hours or to the emergency department. It depends on the policy what you apply in your facility. But for me, the policy for this vagina infection control in staff health clinic, we have a staff health clinic and we have staff health physician. And then if not available, that's the time you will go to emergency department. The healthcare worker should report the incident first to her supervisor. Then a safety reporting system report should be completed. The employee should adhere the following steps immediately after exposure. Actually, I have form here. Check this form for needle stick sharp object injury. There are needle stick sharp injury report, post-exposure follow-up, and then the last I have blood and body fluids exposure report. I will take this one. This injury and also the blood and body fluids, the one I presented in the PowerPoint. It's maybe but two is enough because we discussed this one. Maybe I will be one day. I sorry, no, just an hour. Okay, the first aid. First aid. Yeah. If you experience a needle stick sharp injury or were exposed to blood or other body fluids patient during the course of your work, immediately follow these steps. Okay, I will mention category and what step you should do. Percutaneous injury was needle stick and cuts with soap and water. Then apply isopropyl alcohol 70% and bandage appropriately. You will bandage. You will wash with soap and water and then apply alcohol and bandage. As for percutaneous injury, in mucocutaneous non-intoxicant exposure, this plus water to the nose, mouth, or non-intoxicant. Then irrigate the eyes. How you irrigate the eyes? It's with clean or still water or sunlight. Then plus side for type for 10 minutes. We have here a wash. What's this? I forgot the one. You will pass side for 10 minutes. That's it. Then how you report? Report the injury. You should report the incident. Again to your supervisor. Complete the safety reporting system, and the report should include the date and name, the incident, the location where the incident occurred, where the department employee work, and the source patient medical record, yeah, if known. Huh? Okay, okay, like this. If needlestick is an example, yeah, I said the date of injury, and then include the time of injury, department where injury occurred, and then there's many steps, there's many questions, huh? But I will specify only the questions that important you to be filled up here. Okay. Because this include your what is the job category, injured worker. Who are you? Yes. Are you cleaner or are you nurse? Are you a doctor? Like this. What department? And then there is question here. Was the injured workers the original user of the sharp? You will pick yes or no. No, then include for what purpose was the sharp item originally used? Huh? Is it a known? Injection intramuscular or subcutaneous? And then the next question here. Did the injury occur? While recapping, use needle like that or withdrawing withdrawing a needle from a rubber to other resistant material. And the next is what type of device caused the injury? If it's needle, device it's hollow or surgical glass like that. Its device caused the injury. Needles are disposable syringe, insulin, tuberculin. But the size gauge of the needle and then the surgical instrument or other sharp items. The lancet, is it one? The electrocautery. I just only pick some points concerned, but there's many, and this is in this Arabic form. So you can use here my facility. And there is another one that all English. Yes, check. Yeah, yeah. Yes, this is the one. I separate already. There is a written list in one folder and so that is for you. Okay, the next is the brand manufacturer. The brand manufacturer of product and model. See, they ask also. Mhm. If the item causing the injury was a needle or sharp medical device, what is a safety design? Which are the resist retractable or blunted needle or blades? Yeah. Next, this is it. I'll show you. The marked location of the marked injury means that the marked location. Marked location is it? Marked location. Marked the location of the injury. And then was the injury. Superficial, moderate, severe is included. And the next is if injury to the hand with a sharp item penetrated, single, double, or no gloves. Maybe you got injured, no gloves. And dominant hand of the injured worker, right or left. Then describe the last here on the sample from the last question is describe the circumstance leading to this symptom. This needle, needlestick sharp object injury. So it's included in the management of sharp injury. Is this applicable at home? Yes or no? You can answer it. If someone answer, I will give. I want to ask, is this applicable at home? The management sum of points is you can protect if it happen at home. Same, the only difference is, of course, you don't have reporting system, you don't have OBR. But the management, that some are applicable here. That's why my topic discussion is for my patient, family, and visitors. And who is the visitor? You are now with me. And now, okay, the blood and body fluids exposure report. This one. So this is also Arabic English. So you will write your last name, your first name, of course the date of injury and time of injury, and department where injury occurred, and the department. And then the next is what is the job category. Next is where did the injury occur. So it's similar, but I know the only difference here is the last, almost the Questions: was the source patients identifiable? Yes or no? No. It is, what does it mean? It means that if you know the patient or not, or how you can identify the patient. Then which body fluids were involved in the exposures? So I will show you the difference of this one. Okay. Next is was the body fluid visibly contaminated with blood? You will take yes or no or unknown. Was the exposed part with the blood or body fluids? Then which barrier garments were worn at the time of exposure? Okay. Is this single pair latex, double pair latex, eyeglasses with side shields, face shield, surgical mask or surgical gown, plastic apron. And then what's the exposure? The result of it is direct contact, direct patient contact, or specimen container, tubing slugs, and then ventilator. And it's so many. And there is I will put the link of this from this checklist is from Epidemiology. Means exposure prevention information network. Exposure prevention information network. Next. This is the question concerning the blood. How much blood body fluid came in contact with your skin or your mucous membrane? Example, just splash in your eyes. Then locations of the exposure. Then you will write the number of the location up to the 3 exposed body parts in the blanks below. Largest area of exposure, middle area of exposure, smallest area of exposure. So, same. Same with needle sharp, but on this checklist of the blood and body fluids, they are like this. Small. Location. That's it. That's your sign. That's why if you are exposed for this, you will feel up. Sorry. And then on the last part, describe the circumstances leading to the exposure. Cause. In the last part, cause. It was laboratory judge. The healthcare worker, source, treatment, prophylaxis, it's VIT. HIV vaccine, tetanus, healthcare worker, source, service charge, emergency department, employee health, and others, cause. Okay. also did today is with the team in laboratory. As I mentioned the last 2 days ago that I had a lecture for them. But supposedly when I talked to the head, the head of the laboratory, they are still preparing. So maybe after 2 to 3 days, they are still because they will present to the blood bank and the whole team with the whole team laboratory. But then after 2 to 3 days. So I just go for this topic. And then I'm talking to you this. Okay, I start with reporting injuries because I explain this, check this. This is important. And when I have a survey last a month ago, they asked this for they have question. They check this to me. They asked them my report about exposure. HCW version, HCW exposure. So I need to complete always prepare. Anyway, let's continue. Okay, the physicians evaluating the exposure should obtain the following information. Okay, example, physician. She will complete. Yeah, I already mentioned this. The name of the patient, the time, date, the nature of exposure. It was there. I already mentioned that in the checklist. It's the same. Excuse me. And the modifications, the infectious status of the source. The exposed alcohol should be questioned about the circumstances of the exposure for percutaneous injuries, the depth of the wounds, solid, hollow like that. Yeah, I mentioned that. And in case of a needle stick injury or mucous exposure from unknown HIV positive source, physician should initiate anti antiretroviral regimen immediately upon consultations with the consultants on call. Okay, and then in healthcare workers exposed in blood should be tested for Hepatitis C and HIV. Follow institutional policies for consent requirements to obtain the source patient bloods for fasting. Just 1 minute, guys. Okay, I will continue for the continuation. The source individual's blood should be tested as soon as possible to determine Hepatitis B virus, the HBsAg and the HBsAg anti-HCV, Hepatitis C, anti-HCV, and HIV tests. Serological status. The last year we have HIV screening from MOH. It's mandatory. It's for all staff and it's free. And it's also influenza. But for now, I'm still waiting for the influenza. Um, yes. Tomorrow I will call them again to follow up this. And also for our PPT stuff. This is another topic. The PPT word purified anyway. It's another topic for tuberculosis. But now we need to follow up this. When the source individual already known to be infected with Hepatitis in the HIV testing, the source need not to be repeated. The nurse will notify the patient most responsible patients of the incident. It is the responsibility of the MRV to order the following baseline serology on the source patient after obtaining consent. Last consent. The HBsAg and the anti-Hepatitis and anti-HIV. Counsel the employer regarding the risk of transmissions of bloodborne pathogens in post-exposure prophylaxis. HBV, which is your herpes post-exposure prophylaxis, meaning PEP. This is determined by the HBsAg status of the source and the immune status of the exposed person. The recommended post-exposure prophylaxis for exposure for herpes. Hoping you are not confused because see, I'm mentioning now all the type of the first exposure prophylaxis with hepatitis immunoglobulin with acronyms of SBIG, and or your vaccine should be administered as soon as possible, preferably within 24 hours. Sorry for my chair, it's very noisy because I have chair here. But it's not here now. So I bring this one, but it's very nice. Anyway. The effectiveness of its BIG. What is that? It's BIG. Your immunoglobulin, when administered more than 7 days after percutaneous or mucosal exposure is unknown. Again, the effectiveness of its BIG when administered more than 7 days after percutaneous or mucosal exposure is unknown. Okay. Next, if the exposed person has an adequate antibody response, more than 10 ml, documented after completion of Hepatitis vaccination series. No testing or treatment is needed. Again, if the exposed person has an adequate antibody response, more than 10 ml, documented, after completion of Hep B vaccination series, no testing or treatment is needed. Hep B vaccine and its PIG. Hep B vaccine and human immunoglobulin. Immunoglobulin can be administered simultaneously at separate sites. Separate. The vaccine should always be administered in the what's the right of road of route of administration. The vaccine should always be administered in the deltoid muscle. Another, if Hep C infection persons exposed to Hep C positive source should have the following baseline and follow-up testing. Baseline testing for anti-Hep C, and then follow-up testing for Hep C, RNA, and then no exposure prophylaxis is currently recommended for Hep C. So now, for now, no recommendations. Then HIV post-exposure prophylaxis. Prophylaxis. These recommendations apply to situations in which healthcare worker, the healthcare worker has been exposed to a source persons who either has or is considered considered likely to have HIV. Hello, because I have the mic. Wait, yes, sounded okay. The majority of occupational exposure do not result in transmission of HIV. The average risk of HIV transmissions after percutaneous exposure to HIV-infected blood has been estimated to be approximately 0.3%, and then approximately 0.09% after mucous membrane exposure, and even lower for non-intact skin exposure. Okay, the risk of transmissions after exposure to fluids or tissue after tissues. Other than HIV and pipette, blood is likely to be considered lower than that for blood exposure. Okay. Okay. The exposures to source blood to intact skin now is considered minimal risk. However, any direct contact without barrier protections to concentrated virus in a research laboratory requires clinical evaluations. The toxicity and drug interactions of antiretroviral agents. The person receiving post-exposure prophylaxis should complete full 4-week regimen if tolerated. Okay. I think I need to check my what's this next to check this file. Management of healthcare workers potentially exposed to HIV occupational exposure to HIV should be considered urgent medical concerns and treated immediately. Actually, HIV cases we are very concerned for this case, and this is confidentially mandated. Hmm. Yes. Since I discussed some points concern topics, very sensitive topics, already explained for it. Now we will do the how to follow up of exposed healthcare workers. How will you follow up of exposed healthcare workers? If healthcare workers have experience for experience occupational exposure, example for HIV, they should receive follow-up, of course, counseling, post-exposure testing, and medical evaluation regardless of whether they take PEP, what is PEP, 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 post-exposure prophylaxis. And as I mentioned a minute ago, it was included in our checklist form. This is how to manage if you are a healthcare worker. This included. Then early re-evaluation after exposure, regardless whether what's this whether the healthcare worker provider is taking prophylaxis, then re-evaluations of exposed within 72 hours. And then after exposure is strongly recommended as additional information about exposure or source persons may be available. Okay. Then follow-up testing and appointments. Follow-up testing for a minimum should be followed. Sorry, in short, monitoring for this. Okay, the counseling is important. Counseling for employees exposed to viral hepatitis and HIV for the duration follow-up. This refrain from donating blood, semen, or plasma tissue. Pregnant or lactating women should be advised against breastfeeding. Personal items such as toothbrush or razor should not be shared, of course. Okay. Then more on protections if your partner lets it. Okay. I have a table. What's this? If HIV, PEP is recommended. Okay. If delayed later than 72 hours exposure report, interval after which benefits from PEP are either undefined. The unknown source, needle, perhaps disposal container, or laundry. And this is for HIV. Post-exposure prophylaxis recommendation. Known or suspected pregnancy in the exposed person. Provision of PEP should not be delayed while awaiting expert consultations. Breastfeeding in the exposed person. Provision of PEP should not be delayed while awaiting expert consultation. So, see, known or suspected resistance of the source virus while under through viral agents. If source person's virus is known or suspected to be resistant to one or more of the drugs, is considered for post-exposure prophylaxis. Then selections of drugs to which the source person's virus is unlikely to be resistant is recommended. Okay. And do not delay the initiation of PrEP while awaiting any results of resistance testing of the source person's virus. Toxicity of the initial regimen, but symptoms you must consider when serious medical illness in the exposed person, the significant underlying illness. Exposed provider already taking multiple medications may increase the risk of drug toxicity and drug-drug interaction, of course. If you have many, of course, if you have many medications that you are taking, of course, there is drug reaction, interaction. You will consider that all drugs, or most of them, there is interaction. But it depends to you, because depends on the body mechanism, your immune system. If you are well tolerated, it's good. But if not, sometimes the complication will occur. If the interaction of the drug does not match correctly, that's the time the complication will came. And then always inform your doctor. Hoping on this discussion, my topic today, blood and body fluids, spill cut management, and sharp injury, exposure to bloodborne pathogens. Hope you understand. And I'm here if you have some questions. Actually, if you have question, but I have question. It's very simple question. Who is willing to anyway? Uh, I'm still. You notice that I'm still wearing my mask. I'm still wearing mask because still now this is our number one precautionary measure. But we don't need to put a eye shield, face shield. No, that's only the mask now for the updates regarding our COVID. Anyway, and I think okay. Hello, hello. Okay. It's for additional the or for or little stick. I did not know. For additional information for this, the only difference is tail as the surgical service. But aside of it, same. As you will fill out the name like this, first name, date of injury, and the surgical service site. If it's general gynecology, like on 3 weeks ago, we have one case from our got middle stick injury, but it's not only prick. And then when we assess, it's on the right finger, the middle. It's the location of injury is not bleed. And then, as I told you, the surgical service will included and the surgical procedure will be included also, being performed. And was the endoscopic, laparoscopic, or invasive procedure, they will ask yes, no, or no name. And then what is the category of the injured worker? Word, and the surgeon will sign or OB-GYN, anesthesiologist, the nurse anesthetist, circulating nurse, the scrub nurse, the other nurse, and then include also the housekeeper and physician assistant. Then the next, the injury was sustained by anesthesia team member, but anesthesia thus was being performed at the time of exposure. This kind. And then next, when did the injury occur? Pre-op, at the Mayo, at the back, before like that. And then, was the source patients identified known? Yes or no? You will. And this is exclusively for the team or in the department working on this department. Healthcare workers that work on this department. Okay, they have a separate checklist for it. It was only for OR. And this was the short patients identified, and that's it. And this sharp item was for what purpose was the sharp item originally used? And the next question, did the injury occur? And what type of device caused the injury? See? I mentioned this already. Only the difference is the surgical services because they are lower, so they need to specify the area. They need to specify the services. See the input plus medication. If it's medication ampule, medication vial, vacuum, specimen test tube, or capillary tube. The glass light, automobile, glass item, pure, and the other glass. Then the brand manufacturer of the product. Yeah. The number, the model, the serial, the number. Was this reusable device? Yes or no? Like that. And the medical service was weekly with shaded, retractable or blended needle or blade. The safety mechanism type. The device have needles, insurance, phlebotomy per needle. This one natin, if yes, what can cause the injury? Okay. Patient and patient are both patient and long ends are not affected. And the incident results as an exposure to a hazardous drug. That and what was the locations? And as I told you, this the location. And there is a illustration figured out where you can find the location, the anatomy position of the our this structure. And then if injury was to hand and did the shell penetrate into the dominant hand, injured worker, then pen status of the worker, and then last. Same. The only difference on this one. Describe the circumstance leading to the injury, please. Okay, this was for, I told you for OR. Only for OR. Stop. We have to separate checks for sharp object injury report. The next, the post-exposure. I mentioned this also. This is the one I mentioned to you, the including the HIV. Post-exposure. Most of the question here. In post-exposure follow-up, I will only mention the important pathogens. Which one? Hepatitis B, Hepatitis C, HIV. I already explained to you ahead of some of these Hepatitis B, Hepatitis C, and HIV. The test, the result. One positive, two negative. If source patient was believed to be high in group for bloodborne pathogen, you will check all that apply. Example, blood product recipient, injection drug use, elevated enzymes, hemophilia, dialysis, like that. If the source patient was HIV positive, had been treated with any of the following before exposure, you will take if it's unknown, and then if you have a medication taken before exposure, you should fill up. In addition, the source patients comments care workers. Now, healthcare workers was seen by is the one employee health, emergency room. Like I told you, if the employee health is not available, where you will go in your emergency department. And then, what the first thing you should do is just inform first your supervisor, and then fill up the information here in the checklist. Exposure, huh? Treatment prophylaxis given to the healthcare workers, huh? You will feel the dosage. The treatment HCV, is Hepatitis B vaccine method. And then follow up prophylaxis serological results. See, that's why, because it's post-exposure follow up. Serological results, the time, the date, HIV, that's BSAG, and Hepatitis. I was reviewing this, Iola, and then follow up of Hepatitis B vaccination. Injection after 1 month, after 2 months, injection after 1 year. Okay. Uh, for today topic, hoping you understand some of my discussion today. For my discussion today, it will help. And for further informations or need to have limited clarifications, or if you are in doubt regarding that you are confused or you don't understand or something, you can check my references there on my description. Right there, the link. And then you can comments or ask questions. For some information that you need to get clarification for this topic. So, on the second part, I discussed it without PowerPoint, so it's okay. On this part. I prepared this topics last 2 days after my antimicrobial. This is the next because as I told you, as I mentioned I had a while ago, I told you it has with my laboratory stuff. But now, uh, maybe after 2 or 3 days, we'll come back to you. Hoping you will attend us to us also. And thank you for watching for my lecture topics today. And hoping I can see you again on my next. And I have some preparation for other topic discussion to provide you. I'm sorry for sometimes I lost what I mean is because sometimes I still but now for my connection is good. Uh, I am now more clear because it's good now because I have a backlight with this will help me the big projector. And I before I was using my what's this the ring light, but I discovered not to use it now. This is the while you are more you're more what I mean is you will learn more. So that's why. Because I was pretending before, I think on the 1st of January, it's my first time. It's, it's not the light, the lightings behind me, around me. But now it's good. And, and these sounds. Actually, I'm doing training session here in this room since 2000. I started 2014 or 13. My first, when I stand up here and start. And anyway, I will make this on my blogs. I will also have a blogs now for my joining here, being a speaker. I'm thankful and still now. And I have many topics that I discuss more. Mhm. Okay, guys, that's it for today. And hoping next time you'll be with me again with my co-staff. And thank you for watching. Hope you will learn some of my discussion. Actually, I have Q&A for this, all the topics that I provided, and I will prepare for it for this, for the next class, only for Q&A. And for other sites, wait, just 1 minute for it. And for other sites, I have, of course, I have a members. I will provide a separate day for my membership day also. In those who are, I see it on the almost every time I have a topic to be discussed, I'm seeing some of my white friends there commenting. So thank you. And I will see you again on the next topic. Please like and subscribe. Thank you.